Hi, my name is Morgan Kessinger. I'll be presenting an introduction of autoimmune diseases and their misdiagnosis. The goals of this presentation are to provide a clear understanding of what autoimmune diseases are, including their definitions, the types, and the prevalence of them, to describe how the immune system mistakenly attacks the body's own tissues and the underlying mechanisms that are involved, to review the current treatment strategies, including medication, lifestyle changes, and possible therapies, and to also discuss misdiagnosis or delayed diagnosis of autoimmune diseases and how it affects patients. A brief history of autoimmune diseases starts with Guillaume de Bayeux, the father of rheumatology. He was born in 1538 and died in 1616. He attended the University of Paris, where he earned a Bachelor's of Arts degree in 1568. He subsequently obtained his doctorate in medicine in 1570 and went on to teach for the next 46 years. He was recognized as the first epidemiologist, but he is also known as the father of rheumatology because he was the first to use the term rheumatism in the late 16th century to describe joint disorders. Thomas Sydenham, he's also known as the English Hippocrates. He was born in 1624, and he was known as a very influential English physician. He was referred to the English Hippocrates for his contributions to clinical observation. He emphasized the importance of observing symptoms and clinical signs in diagnosing diseases. He advocated for a more systemic approach to understanding illnesses compared to prevailing theories of that time. He recognized and described various rheumatic diseases, including gout and rheumatic fever. He also introduced the concept of acute rheumatism, detailing its symptoms and progression. William Hibberdin. He was born in 1710 and died in 1801. He is an English physician known for his contributions to rheumatology and internal medicine. He was the first to describe small bony swellings on the distal joints of the fingers known as Hibberdin's nose, which are associated with osteoarthritis. He made significant observations about the nature and progression of osteoarthritis, laying the groundwork for future studies in rheumatology. He emphasized careful clinical observation and documentation of symptoms, which influenced modern medical practices. Bernard Comroe and Joseph Lee Hollander. These two are credited with pioneering the use of the term rheumatologist. Their steadfast dedication and extensive research into autoimmune diseases have played a significant role in shaping the field of rheumatology. Through their groundbreaking work, they have not only advanced our understanding of these complex conditions, but have also laid the foundation for future research in clinical practice in rheumatology. Their contributions have been vital in promoting awareness and fostering advancements that continue to benefit patients suffering from autoimmune diseases. What is autoimmune disease and what causes it? So, an autoimmune disease manifests when the immune system mistakenly identifies healthy cells, tissues, and organs as foreign invaders, leading to an inappropriate and harmful response. This misfiring of the immune system can result in a variety of health issues as it attacks the very components of the body that is meant to protect. Autoimmune diseases are also known as rheumatic illness, and encompasses a wide range of conditions that can affect various parts of the body, including joints, skin, and internal organs. The complexity of these diseases means that while there is currently no definitive cure, there are various treatment options and management strategies available to help alleviate symptoms and improve the quality of life for those affected. With autoimmune diseases, there is always a wide range of symptoms that are involved. Symptoms reported by patients and symptoms assessed by physician play a crucial role in diagnosing autoimmune diseases and diagnosing them correctly. Since there are so many different autoimmune diseases, there are some challenges when using them to diagnose a patient. Some of these challenges can be that the severity of these diseases vary drastically between patients and the symptoms. Um, some of these symptoms are influenced by specific autoimmune diseases. Individual immune system responses also play a role. Some autoimmune diseases exhibit overlapping symptoms. Others have others have unique or diverse symptom profiles. Symptoms may include destruction of specific organs or tissues. Severity and types of damage depend on the disease. Some common symptoms that are seen quite frequently through autoimmune diseases that aren't particular to a certain one, they're just kind of common, are fatigue, infertility, inflammation, irritability, low or high blood pressure, malaise, weakness and pain, and stiffness in joints and muscles, weight changes, either losing weight or gaining weight, anxiety or depression, blood sugar changes, GI issues, dizziness, fevers, and extreme sensitivity to cold in the hands and feet, also known as Raynaud's. Autoimmune diseases affect approximately 8% of the population worldwide. Over 50 million people in the United States are estimated to have an autoimmune disorder. Autoimmune diseases are more common in women than in men, with approximately 75% of autoimmune diseases occurring in female. Environmental triggers can play a huge role in autoimmune diseases, in their progression, concerning flares, or just in the development of them in general. Chronic stress can lead to elevated cortisol levels, which can influence immune function and potentially exacerbate autoimmune diseases. Cortisol has an anti-inflammatory and pro-inflammatory effect, and its balance is crucial for immune regulation. Exposure to certain toxic or pollutants, such as heavy metals and chemicals in food or the environment, can influence autoimmune disease development. An a lack of exercise and sedentary lifestyle can also be a trigger for autoimmune conditions, and there's been many links found between tobacco use and certain autoimmune diseases. Fluctuation in hormone levels during the menstrual cycle can affect disease activity in some women with autoimmune diseases. For instance, some may experience exacerbated symptoms or flare-ups during certain phases when estrogen levels are higher. Pregnancy introduces significant hormonal changes, including elevated levels of estrogen and progesterone. Interestingly, some autoimmune conditions may improve during pregnancy, likely due to the immunological adaptations that occur to protect the fetus. However, postpartum, there can be a rapid change in hormone levels that may trigger flare-ups in some women. Many autoimmune diseases, such as lupus and rheumatoid arthritis, are more prevalent in women than men. This discrepancy suggests that estrogen and progesterone may influence immune function. Estrogen has been shown to enhance immune responses, potentially leading to increased susceptibility to autoimmune conditions. Hormone changes with aging, particularly during menopause, can also impact autoimmune disease incidence and activity. After menopause, the decline in estrogen levels may affect disease progression in women. Disorders such as Hashimoto's thyroiditis and Graves' disease are themselves autoimmune diseases affecting the thyroid. The interplay between thyroid hormones and the immune system can influence the severity and management of these conditions. Thyroid hormones can impact various immune cell functions. Lifestyle factors that affect autoimmune disorders are balance, exercise, sleep, and weight. Starting with diet, a balanced diet rich in fruits, vegetables, whole grains, and healthy fats can help modulate the immune system. Certain foods may trigger inflammation, while others can have anti-inflammatory effects. For example, high sugar and processed food intake can exacerbate symptoms. Regular exercise has been shown to improve overall health, reduce inflammation, and enhance immune function. However, excessive or intense exercise may lead to increased stress and exacerbate autoimmune symptoms. Quality sleep is essential for a healthy immune system. Poor sleep can lead to increased inflammation and a weakened immune response. Higher body weight is associated with increased inflammation and can play a role in the development of autoimmune conditions. Classification of autoimmune disease. Systematic autoimmune diseases represent a complex group of disorders where the immune system mistakenly targets the body's own tissues, leading to inflammation and damage. These diseases arise when autoantigens, which are proteins or protein complexes that normally play essential roles in cellular function, are misidentified by the immune system. Instead of defending against external pathogens like bacteria and viruses, the immune system attacks these autoantigens, found in virtually every cell type throughout the body. Currently, there are about 100 recognized systemic autoimmune diseases. These diseases can affect multiple organ systems, simultaneously causing a variety of health issues that can range from mild to severe. Some of the more commonly known systemic autoimmune diseases include lupus, rheumatoid arthritis, and multiple sclerosis. Each condition is characterized by an overactive immune response that leads to the chronic inflammation of tissues and organs. The exact cause of these diseases is often multifactorial, involving a combination of genetic predisposition, environmental triggers, and hormonal influences. As a result, systemic autoimmune diseases can be particularly challenging to diagnose and manage, as they may present with overlapping symptoms and varying degree of severity. Understanding the mechanisms behind these disorders is critical for developing targeted therapies and improving patient outcomes. Rheumatoid arthritis is a disease that can vary widely, but often include swelling, stiffness, and tenderness. Sometimes there's even a discoloration on the skin. It'll be red, kind of showing inflammation. This often occurs in hands, wrists, and knees. Many patients experience morning sickness that can last for several hours, and symptoms may flare up unpredictably. Fatigue, fever, and weight loss are also common systemic symptoms associated with the condition. Like many other systemic diseases, we'll go over a couple more. The exact cause is unknown, um, but it is believed to be a combination of genetic, environmental, and hormonal factors. Certain risk factors, such as being female, having a family history of disease, or smoking, may increase the likelihood of developing RA. Systemic lupus erythematosus, also known as SLE and commonly referred to as lupus, is a complex autoimmune disease where the body's immune system mistakenly attacks its own tissues. It can affect multiple organs, including the skin, joints, kidneys, heart, and lungs. One of the hallmark features of lupus is its unpredictability. The disease often goes through phases of flares where symptoms worsen and periods of remission where symptoms may fade or disappear entirely. Symptoms can vary widely among individuals and may include chronic fatigue, joint pain, skin rashes. A particular skin rash that is common among lupus is a butterfly-shaped rash that goes across the nose and into the cheeks. Other common symptoms are also fever, photosensitivity, where rashes and skin coloration can occur just from being outside and in the sun, and organ dysfunction. Diagnosis of lupus can be challenging due to the overlap with other conditions and the wide range of symptoms. Health professionals often rely on a combination of patient-reported symptoms, physical examinations, laboratory tests, um, such as ANA, which is an anti-nuclear antibody test, and imaging studies. Early diagnosis and treatment are crucial for managing the disease effectively and improving quality of life for these patients. Scleroderma is also known as systemic sclerosis, is a chronic autoimmune disease characterized by the hardening and tightening of the skin and connective tissues. It primarily affects women, with the onset typically occurring between the ages of 30 and 50, although it can affect anyone at any age. The condition is caused by an overproduction of collagen, protein that helps provide structure and support to various tissues in the body. This excessive collagen leads to fibrosis, which is a thickening and stiffening of connective tissues. Scleroderma can be classified into two main types, localized and systemic. Dermatomyositis is a rare inflammatory condition characterized by muscle weakness and distinctive skin rashes. It primarily affects adults, but it can also occur in children. The exact cause of this condition is not fully understood, but it is thought to involve an autoimmune response where the body's immune system mistakenly attacks its own muscles and skin tissues. Organ-specific autoimmune diseases are conditions where the immune system mistakenly attacks the body's own tissues, targeting specific organs rather than the whole body. This can lead to localized inflammation and damage. Graves' disease is a condition that involves the immune system stimulating the thyroid gland to produce excess hormones, leading to hyperthyroidism. Symptoms might include weight loss, rapid heartbeat, and anxiety. It affects approximately 0.2 to 0.6% of the population though rates may vary by geographic region and ethnicity. Graves' disease is more common in women than men with a ratio of about 5 to 1. It typically develops between the ages of 30 and 50. Individuals with Graves' disease may have a higher risk for other autoimmune conditions such as rheumatoid arthritis, lupus, and type 1 diabetes. Type 1 diabetes is a chronic condition which the pancreas produces little to no insulin, a hormone essential for allowing glucose to enter cells for energy. It most commonly develops in children and young adults, but it can occur at any age. Symptoms may include increased thirst, frequent urination, extreme fatigue, and blurred vision. Since the body stops producing insulin, individuals with type 1 diabetes need to manage their condition through insulin therapy, regular monitoring of blood glucose levels, a healthy diet, and exercise. Unlike type 2 diabetes, which is often related to lifestyle factors, type 1 diabetes is believed to involve an autoimmune response where the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Celiac disease is a disorder where the ingestion of gluten leads the immune system to attack the lining of the small intestine, causing malabsorption of nutrients and various GI symptoms. It is often associated with other autoimmune diseases such as type 1 diabetes, thyroid disease, and rheumatoid arthritis. Approximately 2.5 million Americans are believed to have celiac disease without knowing it. Celiac disease can develop at any age, although it often presents in childhood or early adulthood. About 30% of individuals carry the gene that predisposes them to celiac disease, but only a small percentage of those who have the gene develop the condition. Autoimmune hepatitis is considered a rare autoimmune disease. It is chronic, and it's where the immune system attacks liver cells, leading to inflammation, liver damage, and potentially cirrhosis if it's not treated. AIH is relatively uncommon, occurring in approximately 50 to 100 cases per 100,000 individuals in Western countries. It affects women more frequently than men. This disease can manifest at any age, but is most frequently diagnosed in adolescents, young adults, and middle-aged women. There's two different types of autoimmune hepatitis. The first type is more prevalent form, which can affect individuals at any age and is often linked to other autoimmune diseases and is characterized by specific antibodies such as anti-smooth muscle antibodies and anti-nuclear antibodies. Type 2 is more commonly seen in children. This type is associated with anti-liver kidney microsome type 1 antibodies. Diagnosing autoimmune diseases. Diagnosing autoimmune disorders involve a combination of clinical evaluation, laboratory tests, and sometimes imaging studies. Here are some key steps in the diagnostic process. A thorough medical history is taken including symptoms, duration, family history of autoimmune diseases, and any other relevant issues. A healthcare provider conducts a physical examination to check for signs of inflammation, joint swelling, skin rashes, or other markers of autoimmune activity. Blood tests are also performed to detect specific autoantibodies. Tests such as a C-reactive protein, which is also known as CRP, and erythrocyte sedimentation rate, known as ESR, are used to measure inflammation in the body. X-rays, MRIs, or ultrasounds may be used to assess joint damage, organ inflammation, or other abnormalities. Depending on symptoms, tests for thyroid function, liver enzymes, kidney function, or other organ-specific markers may be conducted. In some cases, referral to rheumatologists, endocrinologists, or other specialists may be necessary for further evaluation and management. After reviewing all the information, including lab results and imaging, a healthcare provider will make a diagnosis based on established criteria for specific autoimmune diseases. The role of genetics can play a huge role in the diagnostic process of autoimmune diseases. Certain genes can increase the likelihood of developing autoimmune disorders. Examples is HLA, human leukocyte antigen. Genes are associated with diseases like lupus and rheumatoid arthritis. Some autoimmune disorders exhibit familial clustering, indicating a genetic component. Some autoimmune diseases are more prevalent in certain ethnic groups, suggesting genetic factors. Example, systemic lupus erythematosus is more common in African American and Hispanic populations. Genetics is a significant factor in the development of autoimmune disorders, but it interacts with environmental elements and understanding these roles can aid in better diagnosis, treatment, and prevention strategies. Common blood tests that are used to help diagnose autoimmune diseases. The number one is anti-nuclear antibody test. A lot of times people say these are the most unreliant because there's many factors that could cause you to have a positive ANA, but it's also one of the first tests that kind of start the investigation process of diagnosing these disorders. It's a blood test that screens for antibodies that attack the body's own cells. The rheumatoid factor test. Rheumatoid factors are proteins produced by the immune system that can attack healthy cells and tissues. Anti-dsDNA test and anti-dsDNA antibodies are a type of anti-nuclear antibodies that target double-stranded DNA. The C-reactive protein we talked about earlier indicates inflammation. ESR we talked about earlier, but it is the distance red blood cells fall in a test tube in 1 hour measured in millimeters per hour. Complement fixation test is a blood test that determines if a patient's serum contains a specific antibody or antigen. Complete blood count test. A CBC is just like a normal blood test that a doctor could perform on you, regardless if they're looking for autoimmune diseases. CBC measures the number of red blood cells, white blood cells, and platelets, as well as hemoglobin, hematocrit, mean corpuscular volume, also known as MCV, and other values. And these are important because autoimmune diseases can really affect the way that your blood works in your body. A comprehensive metabolic panel, also known as CMP, is a routine blood test that measures 14 substances in the blood to provide information about metabolism, fluid balance, and the function of the kidneys and liver. Other tests that indicate autoimmune diseases are X-rays, CT scans, biopsies, physical examination, and just reviewing your medical history. Autoantibodies and their roles. Well, autoantibodies are proteins that target and attack the healthy cells in the body, contributing to the onset of autoimmune diseases. This action facilitates the work of white blood cells, which can also harm healthy cells, ultimately leading to the progression of these conditions. Some common antibodies, we already talked about the ANA, the double-stranded. Antihistone is another common antibody that is found amongst patients with SLE, but can also occur in drug-induced lupus, which is some antibiotics can cause this and it mimics SLE, but typically after someone stops the drug that is causing it, the symptoms go away. Rheumatoid factor, anti-neutrophil cytoplasmic antibodies, anti-CCP, anti-phospholipid antibodies, and anti-thyroperoxidase antibody, antithyroglobulin, anti-syndrome, is associated with limited cutaneous systemic sclerosis, primary biliary cirrhosis, and proximal sclerodoma. The anti-JO1 is associated with polymyositis and dermatomyositis. Anti-LASSB is associated with Sjogren's syndrome. Anti-RNP is associated with mixed connective tissue disease and SLE. Anti-ROSSA associated with SLE, primary Sjogren's syndrome, and neonatal heart block. Multidisciplinary approach is crucial when treating autoimmune diseases. It can differ significantly from one person to another, and they often present complex challenges. To effectively manage and treat these conditions, as well as to improve the overall quality of life for affected individuals, it usually requires a combination of various strategies and approaches. For systemic autoimmune diseases, patients often see a rheumatologist who manages the disease. In addition to rheumatology, they may have to see specialists if disease has injured organs of the body, such as lungs or kidneys, leading them to seek treatment for a pulmonologist and nephrologist. Sometimes common with systemic lupus, as the symptoms affect your whole body, it can also target your liver. And if that liver is damaged, you would have to see a nephrologist. For autoimmune diseases that affect specific organs, patients will consult a specialist for the appropriate treatment for their condition. For instance, a patient with autoimmune hepatitis would seek care from a gastrointestinal specialist for management. Managing autoimmune diseases. For some conditions, surgical procedures may be required to resolve an issue directly, such as cases of tumors, severe injuries, or anatomical abnormalities. Encouraging individuals to adopt healthier behaviors such as regular exercise, sufficient sleep, and stress management can be an effective approach to treatment. These involve dietary changes and supplementation to improve health outcomes, address deficiencies, or manage chronic diseases. There are many medical treatment approaches for helping manage and treat autoimmune diseases. Some of the more natural ones can include acupuncture, herbal medicine, meditation, and yoga. They are often used alongside traditional treatments to promote overall wellness. Some include pharmaceuticals that can help manage symptoms, cure illnesses, provide relief. Examples of this include antibiotics for infection, antidepressants for mental health conditions, and pain relievers. Some approaches use physical methods like exercise, massages, and other modalities to improve movement, restore function, and reduce pain. Some approaches, such as talk therapy, this involves working with a mental health professional to explore thoughts, feelings, and behaviors. Common types include cognitive behavioral therapy, dialectical behavioral therapy, and psychoanalytic therapy. For some conditions, surgical procedures may be required to resolve an issue directly, such as in cases tumors, severe injuries, or anatomical abnormalities. By managing symptoms and controlling disease activity, medications can significantly enhance the overall quality of life for individuals with autoimmune diseases. Some medications can slow down the progression of the disease and potentially preventing long-term damage to affected organs and tissues. Some common medications that are used are known as corticosteroids. These are used to reduce inflammation and suppress the immune system. Non-steroidal anti-inflammatory drugs, also known as NSAIDs. These help relieve pain and reduce inflammation. Disease-modifying anti-rheumatic drugs. These can slow the progression of autoimmune diseases and prevent damage to joints and tissues. Biologic agents. These are targeted therapies that interfere with the specific steps in the inflammatory process. Immunosuppressants. These reduce the overall activity of the immune system. JAK inhibitors. These are a newer class of medications that target specific pathways in the immune response. Immunosuppressants. These reduce the overall activity of immune system. Challenges with diagnosing autoimmune disease. The length of diagnosis. The process of diagnosing autoimmune diseases is often lengthy and complicated, primarily due to the intricate nature of these conditions. On average, individuals may experience a considerable wait time of up to 4.5 years before receiving a definite diagnosis. This extended time frame can be attributed to several factors, including the overlapping symptoms that many autoimmune diseases share with other health issues, as well as the need for various specialized tests and consultations with different healthcare providers. As a result, patients may find themselves navigating a challenging journey through multiple appointments, tests, and medical opinions, often leading to frustration and uncertainty about their health. Lack of diagnostic criteria. The lack of established diagnostic criteria for autoimmune diseases presents significant challenges for both patients and healthcare providers. Unlike some other medical conditions that have clear biomarkers or standardized diagnostic tests, autoimmune diseases often rely on a combination of clinical symptoms, laboratory tests, and patient history, which can lead to misdiagnosis or delayed diagnosis. One of the main issues is the heterogeneity of autoimmune diseases. Since these diseases can manifest in various ways and affect multiple organ systems, symptoms can overlap with other conditions. For example, systemic lupus erythematosus can present with fatigue, joint pain, and skin rashes, which may also be seen in other illnesses. This overlap can complicate the identification of specific autoimmune conditions. Patient's initial presentation. Autoimmune diseases can present a variety of challenges during initial patient evaluation. Here are some common problems with initial patient presentation for autoimmune diseases. Many autoimmune diseases present with vague and nonspecific symptoms such as fatigue, fever, malaise, making it difficult to pinpoint the exact condition. Symptoms can also have a fluctuating course with periods of exacerbation and remission. The variability can confuse diagnosis and timeline assessment. Different patients may show markedly different signs and symptoms even with some autoimmune conditions, complicating the recognition of the disease. Some autoimmune diseases predominantly affect certain demographics, like lupus in young women, potentially leading to a bias in diagnosis. Routine laboratory tests may be inconclusive, and specific tests for autoimmune conditions may not be conducted initially. Some general practitioners may hesitate to refer patients to specialists promptly, particularly if the symptoms do not align clearly with autoimmune conditions. The overlapping of autoimmune diseases is a critical area of study, as they often share common pathways and can affect the same organs or systems in the body. Autoimmune diseases occur when the immune system mistakenly attacks the body's own cells, leading to inflammation and damage. One key aspect of overlapping autoimmune diseases is the concept of autoimmunity spectrum, where patients can present with features of more than one autoimmune condition. These may arise due to the shared genetic, environmental, and immunological factors. For instance, many patients with autoimmune thyroid diseases such as Graves' disease or Hashimoto's thyroiditis may also experience other autoimmune disorders like type 1 diabetes or rheumatoid arthritis. Medical history is so critical with autoimmune disorders. A detailed medical history helps identify symptoms that may have gone unrecognized or attributed to other conditions. Autoimmune diseases have often overlapping symptoms such as fatigue, joint pain, and rashes, making it essential to track their onset and progression. Many autoimmune diseases have a genetic component. A family history of autoimmune disorders can increase suspicion of similar conditions in the patient. This information can guide further diagnostic testing and management strategies. Previous illnesses or conditions, particularly those that may involve immune system dysfunction or chronic inflammation, are relevant. For instance, a history of viral infections or significant stress could contribute to the development of autoimmune diseases. Additionally, some medications can induce autoimmune-like symptoms. Knowing the patient's medication history can help distinguish between drug-induced autoimmune reactions and primary autoimmune diseases. A thorough review of related symptoms can uncover manifestations of autoimmune diseases that the patient may not consider significant. This can include issues like hair loss, mouth ulcers, or changes in skin pigmentation. Understanding the chronology of symptoms can help in making a differential diagnosis. Autoimmune diseases often have a course that can help healthcare providers ascertain the likelihood of specific disease. A case study involving a lupus misdiagnosis. The situation was a 32-year-old female banker was referred after 9 months of persistent joint pain, bilateral leg swelling, and recurrent fevers lasting 3 months. The joint pain initially began in the left ankle post-injury and progressed to involve multiple joints, eventually leading to significant disability. Concurrently, she experienced bilateral leg swelling, frothy urine, high-grade intermittent fevers, and skin eruptions, along with weight loss and loss of appetite. Despite no previous medical history and several extensive investigations suggesting various conditions, she thought most of her suffering was mental. The conclusion: clinical examination revealed a pale woman with bilateral pitting edema and joint tenderness across several areas. Investigation showed anemia, elevated ESR, proteinuria, and positive autoantibodies, leading to a diagnosis of SLE. Based on meeting 7 of 11 American College of Rheumatology ACR criteria, treatment began with corticosteroids, pain management, and supportive care. Outcome. The challenges in recognizing SLE amidst her complex symptoms or prolonged suffering. After treatment, her symptoms improved significantly and she regained mobility before being discharged for ongoing rehabilitation. A case study involving misdiagnosis occurring with rheumatoid arthritis. The situation, patient presents with RA who was twice misdiagnosed with COVID-19 due to non-specific respiratory symptoms and ground glass opacities on high-resolution CT, leading to a delayed diagnosis, interstitial, leading to a delayed diagnosis and interstitial lung disease and prolonged pulmonary symptoms. Differentiating COVID-19 lung imaging from IGL is crucial as both conditions share respiratory symptomology. Clinicians should remain vigilant in distinguishing these diagnoses, particularly in the context of rheumatoid disease flare-ups. RA affects 1 to 2% of the global population and is characterized by symmetrical progressive arthritis and various extra-articular manifestations. Particularly in severe cases, pulmonary complications, including ILD, affect up to 30 to 40% of RA patients and mark the second most common cause of death, following cardiovascular issues. ILD associated with RA can be challenging to differentiate due to overlapping radiological features with COVID-19, which is primarily a respiratory disease characterized by ground glass opacities and consolidations. The pandemic context may contribute to increased misdiagnosis, highlighting the need for careful consideration of differential diagnosis in patients with RA displaying respiratory symptoms. Misdiagnosis of celiac disease is a significant issue that can lead to prolonged suffering and a host of unintended health consequences. Celiac disease is an autoimmune disorder triggered by the ingestion of gluten, leading to damage in the small intestine. The symptoms can be quite varied and often overlap with other conditions such as IBS, lactose intolerance, or even psychological disorders. This overlap creates challenges in accurately diagnosing the condition, as patients may receive treatment for other health issues, while the underlying cause of celiac disease remains unaddressed. Unfortunately, this can result in chronic inflammation, malabsorption of nutrients, and an increased risk of other autoimmune diseases or complications like osteoporosis and certain types of cancer. The misdiagnosis of celiac disease can deeply impact a patient's quality of life. Individuals may endure years of confusion and discomfort, often feeling dismissed or misunderstood by healthcare professionals. If the condition is not identified early, patients may experience a range of debilitating symptoms, including fatigue, anemia, digestive issues, and even neurological manifestations such as migraines or peripheral neuropathy. Awareness and improved education about celiac disease among both healthcare providers and patients are critical to ensuring timely and accurate diagnosis, ultimately leading to more effective management through lifestyle changes, primarily adhering to a strict gluten-free diet. Addressing misdiagnosis not only improves individual health outcomes but can also alleviate the broader public health burden associated with untreated celiac disease. The misdiagnosis of Graves' disease. A situation, a 34-year-old woman whose thyroid crisis due to Graves' disease was initially misdiagnosed as a panic attack. She had been treated for panic and bipolar disorders in an outpatient psychiatric setting. 6 months prior, she lost around 16 kilograms, and her condition deteriorated with symptoms like severe palpitations, tachycardia, throat discomfort, and an inability to consume solids. She presented to the emergency department with nausea, severe tachycardia, fever, and restlessness, which she initially treated as a panic disorder. However, upon observing proptosis, a condition where one or both eyes protrude from their sockets, they considered Graves' disease. Thyroid function tests were conducted, but due to the weakened earlier clinic data was unavailable. When she returned the following morning with no improvement, they again misdiagnosed her as having severe panic attacks, allowing her to go home after a diazepam injection. Later that day, thyroid test results indicated a thyroid storm. The endocrinology team was consulted and she was admitted for treatment, receiving steroid and radioactive iodine therapy before being discharged 3 weeks later. In conclusion, psychiatrists and psychosomatic medicine practitioners must consider severe hyperthyroidism as a potential differential diagnosis for panic disorder. To better the diagnostic process. The roles of referrals. Referrals play a crucial role in managing autoimmune disorders due to the complexity of these conditions. Referrals facilitate coordinated care among different healthcare providers. Effective communication between specialists include that all aspects of a patient's health are considered, reducing the risk of drug interactions or conflicting treatments. Specialists can provide valuable education about the autoimmune disorder, including lifestyle modifications, dietary changes, and self-management strategies. Additionally, they can connect patients with support groups and resources for better coping mechanisms. Autoimmune disorders often require ongoing monitoring, and follow-up appointments to adjust treatment plans as needed. Referrals help establish a routine of regular checkups with the appropriate specialist to ensure optimal management. The quality of life for individuals experiencing a lack of diagnosis or misdiagnosis of autoimmune diseases can be significantly impacted. Many face persistent symptoms such as fatigue, pain, and cognitive issues that remain unexplained, leading to frustration and emotional distress. The uncertainty can create a sense of helplessness as individuals may feel trapped in a cycle of seeking answers without finding resolution. Moreover, without an accurate diagnosis, patients may not receive the appropriate treatment or support they need, which can exacerbate their condition. This misalignment often leads to financial strain due to ongoing medical costs and lost work productivity. Overall, the prolonged search for a diagnosis harms not only physical health, but also mental well-being and social connections, ultimately diminishing the quality of life. Advocacy helps empower patients by providing them with knowledge about their condition, treatment options, and rights within the healthcare system. Understanding their disease allows patients to take an active role in their care. Advocates can connect patients with resources such as support groups, financial assistance, and educational materials, which can help them navigate the complexities of living with an autoimmune disease. Advocacy fosters better communication between patients and healthcare providers. Advocates can help patients articulate their concerns, symptoms, and treatment expectations, which lead to more tailored and effective care. Patient advocates play a key role in raising awareness about autoimmune diseases, both in their broader community and within the healthcare system. Increased visibility can lead to better funding for research and improved resources for patients. Strategies for improving diagnosis include encouraging patients to maintain a detailed record of their symptoms over time, including onset, duration, and any triggering factors. A thorough understanding of patients' history can aid healthcare providers in identifying patterns that are characteristic of autoimmune diseases. Implementing the use of advanced laboratory tests such as autoimmune panels, genetic testing, and advanced imaging techniques to identify specific markers associated with autoimmune diseases. These tools can help in distinguishing between different types of autoimmune conditions and improve diagnostic accuracy. Empower patients with knowledge about autoimmune diseases, including their symptoms and potential red flags, encouraging patients to advocate for themselves and seek second opinions when necessary, can lead to more timely and accurate diagnosis. Foster collaboration among various specialists, including rheumatologists, immunologists, and primary care physicians. This teamwork can provide a more comprehensive evaluation of the patient, allowing for combined expertise that may enhance the diagnostic process. Autoimmune diseases are often categorized as rare, and while statistics may support this classification, the reality is that the complexity and variability of these illnesses could potentially affect a much larger population than is currently recognized. Over the years, significant advancements have been made in the diagnostic process for autoimmune diseases, and research in this field has progressed remarkably. However, there are still numerous instances where patients are misdiagnosed or not diagnosed at all. This misidentification can lead to delays in treatment and can complicate patients' conditions, as the manifestations of autoimmune diseases can mimic those of other health issues. Consequently, a better understanding of these conditions is crucial to improving diagnostic accuracy and ensuring that affected individuals receive the appropriate care and support they need. It underscores the importance of both continued research and raised awareness among healthcare providers and the general public regarding the complexities of autoimmune diseases.